This is LiveWell Talk on Moms and Healthcare. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Coming up this week is Mother's Day, that one day each year that we officially recognize our moms and the contribution that they've made to our lives and the wondrous things they do for us. But quite frankly, every day should be Mother's Day because as we'll get into during this conversation, the moms are never off duty. Here with me today are two amazing team members, nurses and mothers, Chelsea Moody and Kayleigh Grace. Thank you for taking your time with the little ones. Let's start by introducing the little ones.
I have McKay, and he is 5 months old.
I have Lucy, and she is 10 days old, 11 days.
Oh, wow. Congratulations. And you mentioned that you have two others,
yes,
twins.
4-year-old twins.
4-year-old twins. And you?
And I have an almost 4-year-old and almost 2-year-old.
Okay. So you're experienced. You know what you're doing. It's so, we'll get into healthcare, but we'll start just at first. Moms are never off duty. Both my girls, they kind of went through kind of the daddy's girl phase, but man, if they got hurt, mom, they didn't want their dad. And, that's part of just being hardwired as a mom. And I think it's really awesome. But healthcare is one of those jobs, nursing, physicians. It's hard to put bookends on your day, right? And I know people, your spouses probably think, yeah, you work till 5 p.m., but you work till 5 p.m. and the chaos has ended to enough that you can walk away from your team, right?
Right.
I think that's hard to do. And I've often said that the toughest thing about this job is you have to choose between patients and your family. And particularly as men, I think if you make that choice of your career too much, you become kind of a figurehead at home. And then when you are home, you're just in the way. And they're like, get out of my way, Dad, I can do this, So I'm sure that's true with you, but let's start with you, Chelsea. What is your role over at the Birth Care Center?
I am a labor and delivery and mother-baby nurse. So
okay.
I do almost all the things that are going on over there in the operating room as well.
And how long have you been here?
I have been here just over 8 years.
Just over 8 years. Wow. And Kayla?
I do the same
Kayleigh.
exact things as Chelsea. We actually started just maybe 15 days apart.
Yeah.
Oh, wow. Okay.
I've kind of been through it all. I'm labor and delivery, postpartum in the OR as well. I do labor charge and Chelsea does mom-baby charge. So we kind of do a little bit of everything.
There's a little baby boom across the street in labor and delivery, isn't there?
Yes.
And we were both part of the last one, too.
Yeah. Oh, really? The one before?
Yeah.
Okay. Well, here's what we know what COVID lockdowns, that it was it was into the Cubs World Series the last time we had one, something like that. So,
Always an excuse.
yeah, always an excuse. No, but we love the little ones and they are so special. So tell me about how being a mom, never being off duty, but yet you are still expected to have this job. And I don't know what your husbands do, so maybe they're firemen or policemen or something where they also have a job you can't just punch out. But why don't we start with you, Chelsea? How's that influenced your work-life balance?
Yeah. I think it's really important as a mom for me that I still am able to get out of the house, but being a nurse allows me to be here at the hospital, not 5 days a week. I'm typically 3 days a week, 12s. And so that allows me to still have many days off during the week with just my kids. My husband works 5 days a week and he has weekends and evenings off. So, I feel like that's been really helpful. And then also it has allowed him to develop a routine in the evening because I'm not home till 8 o'clock. So he drops them off at daycare. He picks them up from daycare, gets them ready, fed for supper and ready for bed. So I feel like that's been very helpful as well. And as a family together.
And how much trouble does he get in when he says he's babysitting his kids?
He got instructed at an early time to not.
Yeah, you're never. Yes. I had that same lecture too. But Kayleigh, let me tell how healthcare is. Being a nurse and being a mom, multiple children, how's that fit into your life?
Kind of going off what Chelsea said, I think one of the best part about our job is the fact that we can just leave it at work. We have hard patients and hard deliveries, and hard situations, but we don't come home and then have to do more extra work at home. So when we clock out and we come home, we get to be with our kids. And on our days off, we get to be off. We don't necessarily have to worry about, oh, I've got to finish these notes or this paperwork before I, go to the jump park or whatever. I get to just focus on, we wake up and this is what we're going to do today. So I think that's one of the things that I love most about nursing.
And I won't get in the details because it's way above my pay grade, of course. But, at the system, they said we need to be more creative in giving opportunities for young professionals like yourselves to have that flexible schedule. It's just not a 5 8-hour days a week for 40 hours that if you can mix it up a little bit, you will retain people. Because I believe people need three things to be happy in their job. They need to be respected for what they do. They need to have control over their day, and they need a paycheck. And if they can have control, that extra $2 at down the 22 miles down the road doesn't really factor in. But if they don't have control, they're like, okay, $2 extra an hour. You start doing the math. And so I think that is really cool about nursing, that you do have that. And I've heard so many nurses say that over the years, that's exciting for them from that standpoint. So you mentioned you have twins. How did that prepare you for this one?
Twins was definitely a challenge. I'm thankful that they were my first and only children because they required a lot of my attention. But for this one, it just gave me perspective to really appreciate just having one and soaking up every little moment, because I felt like with the twins it went so fast that I was wishing every day away because I wanted more sleep. And so to appreciate each step and milestone has been a lot of fun this time.
Yeah, I imagine it's just chaotic, but yours aren't that much older than this one, right?
Yeah, I think especially this time around, the first time around we got a little creative with, having a 2 or 1.5-year-old-ish at home. This time I had a C-section, and so my almost 2-year-old, he is really having a hard time with the not being able to be picked up and not being able to have mommy at every single, chance. And so I feel like that's a little harder this time, but it's also been fun. Then all of a sudden I'll be like, hey, JJ, my 4-year-old, come grab rock. And then they kind of entertain themselves. So it's kind of fun watching that bond this time around.
Because the 4 or 5-year-old up to maybe like 6 or 7 at the most, they want to be helpers. Yes. They take a lot of pride in, they go get this for you, And then when they're 17, they're like, no way.
Our kids will never be 17.
Yeah.
They stay like this. Right?
Oh, gosh, Telly, it goes so fast. Mine are 17 and 21. Will be 21 coming up. The other one will be 18 in May. Pretty quickly here. Yeah, when they were like 8 or 9, they're like, oh, yeah, don't want to go to the hardware store? Oh, yeah, Dad. They get a pop and just have this great experience. Now it's like, you want to go to the hardware store? They're like, what? Why are you asking me that? Why would I possibly want to do that? So both households you went from man coverage to zone, yes. Right? Now that you have 3. Yeah, that's a big step. Yep. That's a big step. We were always in man coverage, so that was pretty good. Well, Beat, what's it like to come back and deliver at your work?
It's wonderful, to be honest. Knowing that we have the very best care. I myself had 2 scary kind of recovery periods, and knowing that my life was in the hands of my friends was wonderful.
Same with you. It wasn't.
I agree with Chelsea. I feel like she's getting teared up, and I'm going to get teared up because it is. I also, with my first 2, did not have the greatest of deliveries, and knowing your friends are there to have your back, and even this last time, I knew that Chelsea was going to be there, and it was like, you know what? It doesn't matter if nobody else is going to be there because she's going to be there. She's going to be, advocating for me, knowing exactly what happened last time. She's going to be there, And
I'm sure they're under a little stress to perform, though, too, right? Your coworkers. Yeah. Did you feel that way when you're taking care of her?
Oh, definitely. You want the very best for them, but also working in labor and delivery, you see everything that can go perfect, everything that can go right, but everything that can go wrong, and you would never want that for not only any of your patients, but one of your friends as well.
I think labor and delivery obstetrics, it's kind of like anesthesia. It's like just routine, boredom, everything's going fine, or chaos, right? There's no like
it's going great until it's not.
Yeah, there's no like in between. You know, internal medicine, critical care, there's in betweens. There's like a little chaos and you get it back in line. But, you know, anesthesia and obstetrics, that's one specialty is that it's either fine or not. And you just have to be on your toes. And you're right, we do have a good nursing staff. I've always said that I feel St. Luke's, compared to all the other hospitals I've been, and I've been in practice 25 years, and I've been at plenty of them, that it's very nurse-driven, physician-guided, and I think that is just a good model rather than physician-driven. Nurse, you know, it's nurse-driven with the physicians kind of working as guidance. You know, I know sometimes we joke around that I put in orders and I say, well, I put in my suggestions. You guys look at them and you decide which ones you like and do the ones you want. So this has been really exciting. I've enjoyed seeing the little ones. They are so cute at this age, but they will backtalk you when they are in their teens. So Chelsea and Kayleigh, thank you so much for joining me today and sharing your stories. For more information on what it means to be a St. Luke's baby or our top-notch birth care services, visit unitypoint.org/Cedar Rapids/maternity. Once again, this was Kayleigh Grace and Chelsea Moody with St. Luke's Birth Care Services, along with their kiddos. Thanks for listening. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.